All right, Raul, it is time for Ask the Derm. Board certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your most troubling skin questions. We have a lot to get through this morning, so let's go ahead and jump right in with our first question. Now that spring is here, I'd like to start wearing shorts, but I have this large blue vein on my leg. What works better, laser or injections? This is Anna from Fallbrook, and we actually do have a picture. Is this Anna's leg?
Yeah, that's Anna's leg.
Okay.
You know, Erica, as you know, I love lasers. We have about 40 different lasers at our practice, but to answer her question, actually lasers aren't as good as sclerotherapy or injecting that vein with medication to make it go away.
Okay.
So the gold standard for leg veins is still injections. Now, over the past few years, we've changed what we inject into the veins. Everyone used to use hypertonic saline or salt water, but that had a lot of complications and it hurt. We have new medications now which we can inject, which work much more effectively and don't hurt, so the patients are much more comfortable. In fact, if you try to use a laser on a leg vein, it's very painful, whereas when I inject leg veins, they barely even feel it.
What's the price difference?
The price difference is going to be about the same.
Okay.
So I would always choose, 95% of the time I would choose injection over. There's a patient, for example, that I injected one time with one of the new agents, and you can see she probably has 90% clearance.
Okay, very good. Let's go ahead and get to our next question. This is from Joel from Point Loma. Joel wants to know, I recently noticed a growth on my forehead hairline area. How do I treat and remove this growth? Is it cancerous? And this is a selfie that Joel sent in right here.
Yeah, you can see there it is right at the hairline there, and it looks like a brown kind of warty looking growth. Joel's probably in his 30s by the look of this photo, and the good news is for Joel that this looks completely harmless, although I'm sure it's cosmetically annoying to him. No one likes to have a big brown, warty looking growth on their forehead, so it's very easy for us to remove those. We simply just inject a tiny bit of Novocaine under the brown spot.
Okay.
And I can take an instrument and I just gently shave it right off the skin flat. No scars, no stitches, heals within 5 to 7 days.
No scars?
No scar.
Okay.
Yeah.
Very good. Let's get to our next question. After watching the recent award shows, I'm totally freaked out by how overdone some of the actresses looked. I'd like to get my lips enlarged, but don't want to look overdone. Suggestions? This is Pam from Encinitas, and we have a picture. This is Lisa Rinna right here at the Oscars. Now, she's known for her large lips, but these look especially full.
Pam, you're not alone. I was totally freaked out by some of the things I saw as well.
Yeah.
It's unfortunate, but you only see the ones that are overdone. You don't see all the good natural work that is done by dermatologists and plastic surgeons out there. It's only the bad ones we really stick out in our minds. So I think we have a before and after of a patient that I injected. Of course, the top is before and the bottom is after. You can see there's just a subtle enhancement of the upper lip. So it's not overdone, it's very mild. So it can be done in a way that looks great. No one's going to think that you had anything done. It just enhances the lip a little bit.
And how much would something like that cost?
Usually in the $500 to $600 range.
And it'll last how long?
At least 6 months anyway.
Okay.
Yeah.
All right. Very good.
Yeah.
Let's go ahead and get to our next question. My husband gets horrible razor bumps after shaving. Is there a permanent solution to this problem? Charlene wants to know this from Rancho Santa Fe. This is a before picture. Is this her actual husband or somebody else?
No, this is someone else. This is a patient of mine, actually. You can see all the bumps under his neck in the beard area. This is a really bad case, actually. And so what we can do for patients like this, the problem is the hairs grow back into the skin and they cause this inflammatory reaction.
Right.
So what we do is we use laser hair removal. We treat that area, the hairs go away, and all the problems disappear. It's amazing. In fact, I think we have an after photo to show what laser hair removal can do for these patients.
Oh, look at that.
So that's after. Look how the skin, there's no more bumps or very few. It looks nice and smooth. So I've actually done this treatment on myself because for a lot of men who wear shirts and ties every day, the collar can rub on the neck and get all that irritation. So what I did on myself and what I do for a lot of patients is I remove that bottom inch or two of hair, and then when the collar sits on your neck, you don't get that irritation anymore.
Very good.
So it's a real nice trick.
And then how often do you have to have that treatment done?
We usually do it once a month, and after 4 or 5 treatments, the hair is permanently gone. I haven't treated mine, for example, in probably 5 or 6 years, and I still have no problem.
And how much is that going to run you per treatment usually?
Probably in the 200 to 300 range per treatment.
Okay, let's get to our next question. I'm in college and I don't have time to be applying creams. I'm afraid to take antibiotics for a long time. Is there a quick, easy fix for acne? This is Edward from USD, and this is a before and after of what you did for somebody else?
Right. This is a patient who came in, was frustrated because she tried topical treatments, she tried taking antibiotics, but they upset her stomach. So what else can we do? Well, we can make a tremendous impact on these teenagers and these patients that are in their 20s, because when you have really bad acne, it really affects your self-esteem. They don't want to socialize. It really puts them in a bad way. So with one laser treatment, it's called photodynamic therapy, which is what that patient had. What we do is we apply a medication to the skin. It's a clear solution. It sits on the skin for about an hour or two. After that hour or two, I run a laser over the skin. It activates the medication, which causes the oil glands to shrink down. So oil is one of the big problems with acne. So we shrink the gland down, there's no more oil production, the acne clears up. It also kills the bacteria that causes acne. So we strike at 2 things that cause acne, and you can see we get some really great results, and patients are so excited about it.
Where were you when I was in high school? Seriously.
I was probably in high school too.
Good call. How much does something like that cost?
That's usually for one treatment to clear up the skin, it's about anywhere from $1,000 to $1,500.
And then it'll last you how long usually?
Usually at least a couple of years, if not permanently.
Long enough to get you out of that phase, hopefully.
Yeah, hopefully.
Good stuff, Dr. Groff. Thank you so much. We appreciate it.
welcome.
To get in touch with Dr. Groff, we're going to put the information on your screen right there, located in the UTC area. Phone number is also on your screen. And we've got more information also on our website. If you go to fox5sandiego.com, click on that Seen On tab. All right, Raul, let's get it on over to you.
Guys, thank you very much. It is 9:19, still ahead on Fox 5.